Do you constantly feel dry eyes, dry mouth, and unexplained fatigue? You could be dealing with Sjogren syndrome, a condition that's more common than you think, but often overlooked. Hello, this is Dr. Siddharth Damber from Chicago Arthritis and Regenerative Medicine, where we specialize in helping you manage chronic musculoskeletal and inflammatory conditions with cutting-edge, non-surgical care. Let's dive into today's topic. Sjogren syndrome is one of those conditions that hides in plain sight. Many people struggle with its symptoms for years before getting a diagnosis. Today, I'll help you understand what Sjogren syndrome is, how it's diagnosed, what tests are involved, and the clinical symptoms you need to know. We'll cover treatment in a future discussion. But for now, let's focus on understanding this condition. Sjogren syndrome is a chronic autoimmune disease where your body mistakenly attacks its own moisture-producing glands. This leads to two hallmark symptoms: dry eyes, often causing irritation or a gritty sensation, and dry mouth, which can lead to trouble swallowing or frequent dental issues. It doesn't stop there, though. Sjogren's can also affect other areas, including the joints, nerves, and other organs, such as the lungs and the kidneys. It's often associated with other autoimmune conditions as well, like rheumatoid arthritis or lupus. Sjogren's is most common in women, especially those over the age of 40. However, men and younger people can also develop it. If you have a family history of autoimmune conditions, your risk may be higher as well. While dry eyes and mouth are the hallmark symptoms, there's more to Sjogren's. Fatigue is very common. This isn't just being tired, it's an overwhelming exhaustion that doesn't go away. Joint pain and swelling can also be present. Often confused with other forms of arthritis, this is truly inflammatory arthritis causing inflammation in the joints. Swelling of the glands can also occur, particularly around the jaw or neck, the salivary glands. Digestive issues like heartburn or trouble absorbing nutrients can occur. Brain fog or difficulty concentrating or remembering details is frequently mentioned. Skin symptoms such as dry or itchy skin, rashes, and even sensitivity to the sun. Neuropathy can also occur, meaning numbness, tingling, and pain from the nerves, and also shortness of breath if there's inflammation in the lungs as well. So how is it diagnosed? Diagnosing Sjogren syndrome can be tricky because its symptoms overlap with other conditions. A thorough evaluation typically includes a good medical history, reviewing your symptoms like dryness, fatigue, and joint pain. Physical examination as well. Your doctor may check for swollen glands, dry skin, or joint inflammation. Additional testing for Sjogren's is also key. Diagnosis often involves multiple tests to confirm the condition. Blood tests, including checking for antibodies like your SSA and SSB antibodies, which are often present in Sjogren's. Your doctor may also check for your ANA and rheumatoid factor levels. A Schirmer's test, this is a simple test that measures how much your eyes produce tears, will typically be reduced in Sjogren's patients. Salivary gland biopsy, a small sample of tissue can confirm inflammation in your salivary glands as well. Imaging tests like salivary gland ultrasound or sialography can provide a clear picture of gland function as well. A lip biopsy, occasionally done to look for immune cells attacking the glands, can also be done. One of the reasons Sjogren syndrome is often missed is that its symptoms are on occasion nonspecific. Many patients attribute dry eyes to aging or fatigue to a busy lifestyle. It takes a trained eye to connect the dots, which is why working with a specialist in autoimmune diseases is so important. So why is early diagnosis important? Without treatment, Sjogren's can lead to chronic dental issues, including cavities and gum disease, vision problems from chronic eye dryness, or even organ damage such as kidney or lung complications. Neurologic symptoms like numbness or tingling can become chronic, but by diagnosing early, we can help minimize these risks and improve your overall quality of life. Sjogren syndrome doesn't always occur alone. It's often found alongside conditions like lupus, rheumatoid arthritis, or thyroid disease, in which case it's called secondary Sjogren's. If you already have one autoimmune condition, you might be at higher risk for developing Sjogren's as well. If you're experiencing the symptoms we've discussed, don't ignore them. Start by consulting your primary care physician or a specialist in rheumatology. They'll guide you through the evaluation process and, if needed, create a personalized plan to address your symptoms. I hope this overview of Sjogren syndrome has been helpful. Remember, if you're dealing with dry eyes, dry mouth, or other unexplained symptoms, don't hesitate to seek answers. At Chicago Arthritis, we're here to guide you through diagnosis and provide a tailored approach to managing autoimmune conditions. For more information, visit chicagoarthritis.com. If you found this content helpful, give us a like, subscribe to the channel, or share with your friends. Thank you for watching, and as always, live well.